One of the main things about prostate cancer is that a diagnosis of prostate cancer isn't an immediate sentence, if you like. This is a disease that is very, very treatable and manageable. And when people hear cancer, they're often immediately taken aback. But prostate cancer is a disease that in many cases is curable, and when it's not curable, it is treatable, and something that can be managed just as other conditions that are not necessarily curable, like diabetes or high blood pressure. I think it's important for people with prostate cancer to be aware of their overall health. There are many determinants to how we live with this disease and how this disease affects us. And so being aware of your general health in terms of diet, exercise, and other modifiable behaviors that can help you live well with the disease, but also live well with some of the side effects of the treatment of the disease are things to be aware of. Really ask questions, and I always say, one of the most common things I've noticed is, and it happens for me, is after a visit with your doctor, all the questions you wanted to ask come to you 5 minutes after you leave the doctor's office. So, have a notepad with you, have a pencil with you all the time. If questions pop into your head, write them down, and then on your next visit you can go through a whole list of questions with your doctor. At the BC Cancer Agency, we have several different educational resources available. There is an excellent library, which in Vancouver is in the building across the street from the cancer center that I work in. And there are librarians on staff who are trained to and very much want to help patients and family members access all the resources, either in print form or online, to help them learn more about their disease and how to manage the disease and the potential side effects of treatment. We have we have an excellent website, www.bccancer.bc.ca, which again has patient resources and has on every chemotherapy regimen that we use information both for healthcare providers as well as for patients. We have our psychosocial team, which again can help patients and family members cope with the many psychosocial impacts of dealing with cancer, and also can help get you connected with support groups outside of the agency. And one important point to make them aware of is, what are you planning in your life? Do you have a big trip that you want to go on? Do you have a child's graduation or a grandchild's graduation that you want to go to? And allow us to look with you forward through your calendar so that we can sometimes time the treatments to make the benefits of them the best for you, so you can live the life you want to live.